Thanks, Jeff. Damon, you have been working on this document for months, updating it as you gather more information. What are the overall goals here? What do you want city officials to do with this?
It's actually been a year Valentine's Day. Okay. So the mayor had offered me a job. I told him I didn't need a job, but that I would be willing to volunteer to start talking to everybody connected with homelessness. And so the idea was to put together a plan that both the county and city could work on together, or at least the outlines of a plan, with the understanding that we would have to have short, medium, long-term goals all working together. So I am on my, no kidding, 54th draft.
Oh my goodness.
Because every time I talk to somebody, I end up, if there are major changes, I'll make the changes. And so I think we're close to getting some kind of agreement. I haven't talked to the county yet. I've talked to individual commissioners, but city councilors and the mayor's office has been great about giving me access to staff. The community's been great in terms of talking to people and getting input. It's not perfect, and it's certainly not a Bible, but it's now 62 pages, and most people are waiting for the movie, but it's in pretty good shape.
Jenny, let me turn to you. I spoke with a man who was formerly unhoused, and we'll meet him later in the program. He emphasized that it takes much more than presenting resources to people. There has to be significant trust building because there's a lot of trauma and mistrust among folks who've been on the street. How does your organization address that?
Sure. Our basis and hallmark has been about not waiting for people to come find us, and really our entire model is understanding the circumstances of homelessness. So since 1985, when we were one of the original demonstration projects, every service we have, every service we might add in integrated health, broadly defined, it can be taken out in the field. And we're just very committed to that. And every time we start to build more four walls and more buildings, we scale it back, because really it's important that we go where people are and provide the care right there in the field to them, and do a lot. Everyone in our team is trained. We have over 100 employees. Everybody's trained in engagement and customer service, whatever we call that, but just really an ability to connect with people, understanding the trauma that people have experienced and why they're very marginalized and feeling isolated. So everyone's trained trauma-informed care and engagement, from the entire organization, administrators, billing people, frontline staff.
Does it take a lot of connections to finally get someone?
It does.
We'll take advantage of this.
But it's a range. It's like, and Damon, you said this in your draft here, like it is not a monolith. People who experience homelessness have an experience in common, and they are as diverse as we can name it. And whatever their personal vulnerability that has allowed them to fall through the cracks of the holes in our structures that are failing them, we really need to be able to be responsive to that and understand some people will connect right away. A couple days, we're good, they're on their way, they're back housed, and some will be years. And so we have to really, we're trying to figure out how to be better at just telling people that, but really demonstrating it and showing how long does it take on average, how many contacts, what kinds of contacts, where do people go then in higher levels of care, getting housed, getting an income, addressing all those structural barriers to remaining housed and healthy. And we've begun to do some really good data analysis on that. And we know that there are people that come into our clinic, our four walls, and then we lose them and we re-engage through outreach. We have data on people who only get care through outreach, people that get the best care through referrals. So we really, I think that our sector needs to demonstrate it better and not just overpromise in our heart of hearts, so we're working on that.
That's great. John, we hear a lot about barriers to services for people who are living unhoused. What are some of the biggest roadblocks that you see? And is Mayor Tim Keller's administration doing enough to address those?
Barriers, it's trust. People are vulnerable, and they're in situations that even when they do connect, there's still kind of levels of how to do that and where to go and all those things. So when organizations go meet people on the street and take care of services and connect there, but to set up appointments and all the rest, often it's difficult to get people into appointments and then follow up, because often it falls apart. A lot of times nonprofits, we have a difficult time with connections. and kind of continuum of care that passes people through a system.
Do you mean among the nonprofits?
Through the nonprofits, but the system itself. It's
Yeah.
so people, they have to go to an appointment here and then there, and things fall apart in between and all the rest. And so I mean, there are a lot of barriers in the system level.
Do you think Mayor Keller's administration is doing enough to address some of these?
No.
Okay. Say more
I-
about that.
It's difficult job. I totally understand, and I think we put too much emphasis on kind of the city solving something, but we also have to hold them accountable. And so there's so many large issues, but this one is integrated in all the other issues, or is a systemic piece of all the other issues. And so we need more vision, more leadership, a citywide approach to kind of bring the city together around an issue. So it's not, we have one solution here, or we'll try this here, or something else. But we have to really need leadership to help shape how the city who we want to be as a city, and how we want all of our neighbors to thrive.
Damon, I see you nodding.
There's two things I want to tell you. One, I'm sitting here with Jenny and John. The wonderful thing about working on this project is these are real heroes in the community. Innovative, out there every day for years, working with the community. But the whole homeless issue needs two things. It needs structure, which means a plan. So we need to figure out short, medium, long-term goals. We also need money. This is what we were talking about before the cameras went on, is that it's not just a city or county problem, it's a state problem. Over 35% of the homeless population in Albuquerque is from outside of Bernalillo County, but within the state. And we need the state to be real actors in it with money. And that's why I'm hoping special sessions coming up, and my message very strongly is, we need money.
Damon, you have short-term, medium-term, long-term goals in your report. So I think for short-term, you propose upgrading the West Side Emergency Shelter, but you also acknowledge two key criticisms. It's 20 miles outside of the city, which continues the idea of pushing unhoused folks outside the community, and it doesn't follow best practices, which have shifted away from large congregate shelters. But you're proposing a lot more renovations and additional services there, so why put resources into it?
Because we have 400 to 600, maybe sometimes as many as 700 people out there. This isn't going away overnight. Am I happy about it? Is it right now out of a Charles Dickens novel? It's terrible. It just is. But we have to make that better, but we have to understand it can't be permanent. We're going to have benchmarks. What I've agreed, as I'm talking to various advocates, the compromise was, let's put money in there to make it at least livable, to attract people off the streets, along with other things, motels, office buildings, apartments. Encourage people to get off the streets in the short term, because in the long term, we know that housing with services is the solution, but it's going to take years. We're not going to get out of this right away. So we really don't have a choice. With the West Side Shelter has to come regular transportation. You're not going to be able to do that by having twice a day transportation out to the shelter. You're going to have hourly shelter. But is it a great solution? No, I'm not jumping up and down about it, but it's there, people are going there, and we need to make that a livable space.
Well, John, you and your organization have been working with unhoused people for a long time. What do you think are the benefits and the drawbacks of a big coordinated effort from the city like the one Damon's working on?
I applaud it, and I don't trust it. I mean,
I get that.
like I think, yes, we need big vision. I don't know how much, if we need more money.
Really?
I think we need to actually have new ideas. I really feel like we need to all take a deep breath and say, how are we doing with the money? Where is that money going? And not saying don't do it. Like, it needs to keep going. What we have needs to keep going. But I think we need to actually say, is our approach keeping up with the needs? And how do we think about it differently? How do we actually not do kind of top-down big plan solution, but how do we really empower local communities, local groups, nonprofits to really start working from grassroots level up and then coordinate that together?
Can I talk to that for just a minute? I think that's right. But the way to do it from my point of view is with data. We have lots of providers out there, but we really don't know who is being effective and who's not. And that's really under the medium-term solution. So he's talking about efficient use of taxpayer dollars. I totally agree with that. So how do we do that? Well, we figure out what are the goals of each of these nonprofits or anybody else that's involved? How are they measuring those goals? Are they meeting those goals? And if they are, that's a program we want to expand. And if they're not, we have to get in there and figure out why. And then we can figure out capacity. So I do agree, as part of this, we have to have a more efficient use of taxpayer dollars. But housing, affordable housing, is going to cost a lot of money. And I can tell you right now, the city and county do not have that kind of money.
Jenny, you and I talked in the early days of the pandemic, you might remember, and I recall that you were marveling that these issues around silos had fallen away as people had this idea of all hands on deck to address this immediate crisis. I sense that did not last. Is there a way to bring back that urgency?
Sure. I think that's what I like about this draft paper, and I think that's where I might just have maybe a different angle. I think on what both of you were saying, we need a big plan and we need an implementation plan, and we need all hands and we need many layers deep. And that's what we heard during the pandemic. Everyone pivoted, we shifted, we were working together every single day. Yes, we had more resources, but I think it was a prioritization of existing resources. Yeah, right. And it was toward shared aim, intended goals. This will sound familiar for Built for Zero's approach, which I think you'll probably want to talk about a little bit, Damon, at some point. But I think we need to have all of the above and not either or. And I think the short, medium, long term, it's not a linear thing. It's a complex issue with some really big but simple solutions. So I think with all respect to our communities, and I know there's a thought about who's being left out, it has to be bottom up, but it's not just a big tent. Everybody get in the room, come up with your ideas. We do too much of that here, and we will not have impact. There are proven models. In emergency, there's all hazards preparedness. There's a command central, there are clear, and that might not feel philosophically okay to us, but everyone's role is clear. Who's in charge is clear. Who's committed is clear. The allocation of resources, and I think that across the country, those big ideas are there. We need to implement them across political cycles, because it's going to take time. But I also feel there are two things in this conversation. One, we've spent so many decades talking about how hard it is to get housing online, and I think housing needs to be in the short, medium, and long term. It needs to be in all of the above, because there are things we can do. I think that they are policy and philosophical and collaborative excuses. I also think nonprofits are not the system. You know, none of our organizations are ever going to be big enough one-stop shops. I think that we are trained, I'm going to say this, trained and conditioned in the nonprofit sector to sort of beg for money to keep our doors open, and we believe in our mission, and then overpromise, underdeliver, not ask for enough money. It's just a very realistic, and then that maintains the status quo, and we have to bump out of that as well.
That's all the time we've got right now. Thanks. And you three, we will be back at the table in a bit to talk about other possible solutions, so hang tight.